Hello, my name is Katia Machado, and today I'll be talking about the roles and responsibilities of the registered nurse. This will include the recent changes and their impact on the roles and responsibility of the registered nurse, the role of the Nursing Midwifery Council in relation to the nursing practice, the implication of the Code on Nursing Practice and the role of the registered nurse, the need for effective communication in the multidisciplinary healthcare settings, evaluation of the effectiveness of the multidisciplinary approach in healthcare settings. The recent changes and their impact on the roles and responsibility of the registered nurse. In this slide, I'll be talking about the technical and scientific advantages, the social, political, economic, cultural, ethnical factors within the registered nurse's role. The function and responsibilities of registered nurse are always changing due to a variety of reasons that influence the continually expanding and changing nature of the profession. There used to be a lot of overlap between nurses' duties and the list of domestic tasks, but over the past few decades, this has radically altered. Due to their extensive training and reward experience, nurses now have more responsibilities than ever before. To help nurses manage medical emergencies without calling the doctors, educators are putting more emphasis on teaching them how to do so. Instead of being seen as a doctor helpers, the profession is now commonly thought as an autonomous clinician with medical knowledge who can manage and provide the best outcome possible in challenging circumstances. Nurses are now able to prescribe patients with medication, make clinical judgments that carry a lot of responsibilities due to ongoing and ever changing demands brought by the increased number of patients who require a greater level of care. When COVID 19 started, nursing students suddenly found it difficult to enroll classes and find placements during COVID 19 outbreak. Online training became a swift answer. To help the overworked workforce that requires more people to provide crucial care, many students, mentors, and teachers take on and return to clinical practice. To aid the service recovery from the pandemic, 50,000 more nurses were to be educated by 2024. Technical high quality healthcare system mainly depends on clinical record notes to preserve all pertinent clinical data and maintain records for future use by physicians who will need these notes to comprehend the patient condition. For record of keeping and confidentiality purpose, paper patients charts were handwritten and stored on specific made shelves before modern technology was invented. Electronic systems have been now employed to record patients' information more frequently over the course for the late 20th centuries. This has greatly benefited the healthcare industry as notes were produced and saved on electronic systems, accelerating the producer and enabling the system computers to store the clinical notes. Patient care, there has been a tremendous growth in the nursing profession over the last few decades. Because of its history of adapting to its surroundings, it has been shown that can change within the times. Thanks to advancement in the field, nursing has gone from being a poorly respected profession to one of that deserves great respect from both nurses and patients. There are four specialist categories within nursing, which consist of adult nursing, which is working with patients above the age of 18, pediatric nursing, which is working with patients below the age of 18, mental health nursing, which is working with patients who have been diagnosed with mental health illness, learning disability nursing, which is working with patients in all ages who has been diagnosed with learning disabilities to be able to give them special care when they are hospitalized. The role of Nursing and Midwifery Council in relation to the nursing practice. In England, the organization in charge of regulating and establishing standards for nurses and midwives is Nursing Administration, also known as NMC. It evaluates the education, training, conduct, and performance of nurses and midwives with the help of its members. In December 1919, nurses were required to obtain a license that they were able to practice. It has been recognized as the Nursing and Midwifery Council from April 1st, 2002. As part of the system, nurses can encourage a high standards of education within the nursing profession, allowing them to continue ongoing their skills throughout their careers. Nurses will be allowed to register annually under a new regulation that will allow them to provide a CPD, continuing professional development plan, throughout the year, ensuring that they are improving their clinical abilities considering the ongoing changes in healthcare environments. Every 3 years, a nurse's registration must be renewed to continue practicing as a nurse. After the registration expires, the nurse is required to complete 35 hours of CPD throughout variety of online courses, in-person learning opportunities, and other nursing related activities. Nurses who do not report their CPD hours and verify them on the NMC website under their unique registration code will be investigated by the NMC. Registration code will be investigated by the NMC and formal hearing will be requested. Depending on the outcome, the member may be subjected to a more serious sanction. Can be publicized. The NMC also has authority to compose sanctions, caution suspensions, and striking off orders. This is to improve public protection and also rules of regulation to enable nurses to be able to follow clear systems to be able to practice within the guidelines. The implication of the code on nursing practice and the role of the registered nurse. The code of conduct consists of several statements that, when taken as a whole, capture the core of what nurses, midwives, and nursing assistants should do in order to practice in morally upright and ethical way. The code of practice includes: you must treat people as individuals and respect their dignity. You must treat people kindly and considerately. You must act as an advocate for those in your care, helping them to assess relevant health and social care information and support. You must do not discriminate in any way against those in your care. Employers and unions will be able to observe that code and act responsibly and professionally when conducting campaigning at this time by enforcing it. The NMC can make sure that registered nurses and midwives are qualified and use their relevant abilities in consistent manner in accordance with the standards expected to protect public safety. This results in patients feeling that their private information and what they discuss with the doctors will be handled confidentially. And that action will be taken if this isn't done properly. Discipline might be applied if code is not followed. Misconduct and unsuitable conduct are a couple of instances. The medical professional runs the risk of losing their entire registration and being unable to continue practicing in their jobs if they therefore fail short of code criteria. The 4 P's of code consist of prioritizing people We need to respect patients' individuality and respect their dignity. Practicing effectively, which is communicating and with others clearly, respecting others' views. Preserving safety, which is making sure knowledge is fully acquired prior to beginning a new job, accurately recognize, taking in, and evaluate the individual normal or struggling mental health and to take appropriate action as needed. Promote professionalism and trust. Keep a high level of professionalism at all times to make sure you are following the rules and be conscious of how your action can be a significant impact on the others. The need for effective communication in a multidisciplinary healthcare settings. Communication is crucial. It is a foundation for all other factors. If team members are not communicating well with one another, it will be difficult to properly plan for care, make decisions, or share information. Practical obstacles to productive multidisciplinary teamwork include conflicting personalities, overlapping tasks and duties, poor communication, stress, distractions, and time constraints. When experts don't work well together, resources might be wasted, and patients might get confused and lose faith in the team, and patients' care and safety might suffer. Although the staff members have complementary skills, objectives might not be met without good communication and information exchange. The best result for service users come from sharing knowledge and coordinating care plans. Staff, patients, and where necessary, relatives, carers must all collaborate to deliver person centered care that is coordinating within a multidisciplinary context. A patient demands can be better understood and considered in care plan with proper communication. The NMC code repeatedly emphasizes the importance of excellent communication for providing this coordinated, effective care. Tools are provided to facilitate communication. Clinical care pathways offer concise, evidence based guidelines for disease management, which makes it easier to coordinate treatment planning throughout the team because the pathway informs the choices made by healthcare practitioners. Similar to that, clinical guidelines offer a model for team members to follow so that the patient receives the same advice regarding treatment alternatives. This encourages communication and team decisions based on the best available evidence. To connect their separate tasks and produce the best possible care for each patient, a competent multidisciplinary team recognizes and understands the roles within their respective field of expertise, providing patients with a support that is specifically suited to their needs, as well as comprehending the unique circumstances of each patient by creating a strategy. There are various numbers of jobs in this field, including the following: nurses, doctors, care coordinators, social workers, paramedics, receptionists, and many more. The evaluation of the effectiveness of the multidisciplinary approach in healthcare settings. Using a multidisciplinary approach entails bringing together experts from various healthcare settings to create the best possible patient care plans by fusing their distinctive and effective systems. Since we are all unique human beings, the healthcare professional will have wide range of abilities, approaches, and skills. Teams can connect together in this way to listen to one another, form the best teams possible, break down each problem effectively, and provide the best results for the patient. Successful characteristics of a multidisciplinary team should include a good level of team understanding and what each role and duty consist of, high standards of team collaboration in order to create and maintain an efficient team. Clear and excellent level of communication within the team to be able to create the best program for the patient in to be able to achieve them. Every person within the team to be able to understand their own roles, clearly creating an easier system for the process as a whole. Now I'll be talking about the advantages and disadvantages of the multidisciplinary team. Advantages. This can improve quality of patients all around care and outcome to the situation. The role of each employee is to find and work procedures are streamlined as one having eyesight from multiple perspectives on the same topic to be able to come to a conclusion, which is the best suits the situation and patients. Constantly learning from colleagues and due to a different communication and handling techniques. Build a strong, interesting team which encourage good team decisions, making a better work lifestyle, also job satisfaction. Disadvantages. Individual will have different backgrounds and opinions, views on topics, which could be a positive or a negative. The costs, poor communication between colleagues, lack of understanding between workers. While this system has both benefits, drawbacks, I think the benefits outweigh the drawbacks. The wonderful thing about patient-centered teams is that they break down each position into a smaller, more focused roles, allowing teams members to learn more from one another and develop new abilities. Working in the healthcare industry becomes less stressful and more gratifying when these processes are in place, well implemented and complemented by a professional attitude and an open minded mentality. Additionally, it gives patients a better chance to receive the best medical care possible because it has been developed by numerous people with diverse backgrounds. And that is all for now. With this project, I've got a more understanding of the role and responsibilities within a registered nurse role, and I hope you have too. I would like to say thank you for taking your time to view my presentation.